as I've spent time in practice and really strived to develop my craft and technique and abilities as a surgeon, I've come to understand more and more and really actually working as a team physician and athlete myself, that surgery is a sport, and it's a team sport. And so while I spend a huge amount of time practicing, getting better, preparing for cases, and trying to sort of play my part or my position as the surgeon, it's also important to understand that there's a team around me. So anesthesiologists that really manage people closely while they're asleep. In a lot of cases for the procedures that we do, we'll use regional anesthesia, nerve blocks and things like that, because that actually helps manage the pain during the first couple nights when it's the worst. I have excellent office staff, a clinical athletic trainer who can be in contact with athletes and their team athletic trainers, or physical therapists for people who are rehabilitating from surgery, and also leading up to surgery, helping answer last-minute questions and make sure that we're prepared and ready to go on game day. I'm fortunate to work with an outstanding surgery scheduler and medical assistant as well, and have an excellent team around me in the clinic, so that even if I'm kind of tied up in a room seeing somebody, or days I'm in surgery, there are people around me who are available to communicate and make sure we take care of your needs.